Hi guys, how's everybody doing? This is Dr. Dave Kajila, your good friend here in Canada. Yeah, we've had a beautiful day, very sunny. Feels like summer today. So I've just finished work and going home. But I thought I should address something, continuing to address this issue of pharmaceuticals being stolen in Zambia. So just from the outset, I would like those of you who are watching me to know that this topic is really about Zambia, but I also touch a little bit about the Canadian system of pharmaceutical distribution and how can countries in the developing world ensure that they have a system of drug distribution right from the source where the drugs are manufactured, whether they're procured from within the country or procured from abroad, the whole system from manufacturing all the way to the patient, where the patient receives the medication. Why am I talking about the Canadian system? And just to show you a segment of it, and perhaps help regulators in Zambia and other professionals and stakeholders who are involved in this area, very critical part of healthcare, to learn a few ideas on how we can improve the efficiency of delivering the much needed drugs to the people who need it the most, which is the patient. This issue is very topical because we know, those of you who have been following the news, you know that the American government, through its ambassador to Zambia, recently, in the last few days, had a press conference where he came out very, very emotionally and very clearly stating that the U.S. government was withdrawing $50 million of the grant that has been supplying ARVs to patients, anti-tuberculosis drugs and anti-malarials to Zambia for many, many years. This is beside other support funding for healthcare in Zambia, which amounts to about 260 million per year, according to some sources. So we may say a lot of things, bad things about the Americans, what they do, but they also do a lot of positive things. And 260 million of American taxpayers' money being channeled into Zambia. And you can imagine how many other countries around the world that have benefited from this. In my last video, I talked about President George W. Bush and the program he started. I think it was called PEPFAR, which allowed for patients with HIV/AIDS to access much needed vital medication for their well-being. And we've seen the impact of those drugs, especially on HIV, AIDS, malaria, which accounts for the majority of deaths attributed to infectious disease. The deaths due to that have significantly declined because of this support. So we have also heard from both the government officially, initially the Minister of Health, and then a combined press conference with the Minister of Foreign Affairs, the Home Affairs Minister, Health Minister, and his officials. But the focus for my discussion today is not to critique the back and forth on this matter. What has prompted me to come out here and make a suggestion is I watched the interview that Victor Nyasulu, who's the most recently fired Director General for ZAMSA. ZAMSA, I think, stands for Zambia Marketing, something about drugs. You know, it's the agency that was created in 2019 by an act of parliament to replace this Zambia Medical Stores, which over the years was the entity that was government-owned entity that actually supplied drugs to all the hospitals in Zambia. In prior years, as you know, Zambian healthcare system was universal healthcare at the time during the Kaunda era, and we've continued to pursue that format of providing universal care, though there's the Zambian system also has private hospitals, so it's not purely universal care, but there's a move to try and get to that level. Now, what are we talking about here? We're talking about the theft of drugs from the healthcare system that has actually, or should we call it perennial or endemic theft of drugs from the healthcare system that has led to the American ambassador Gonzalez to come out and say enough is enough. We're tired. We're now going to withdraw the support that we give you. Now, this particular $50 million support is in form of actual drugs, not in form of cash, but actual drugs. And Mr. Gonzalez bemoaned the fact that the Zambian government had not undertaken enough measures to stop this theft of drugs that were being found in pharmacies, in private pharmacies. This is donated drugs that are being found in private pharmacies and are being sold by those pharmacies to people when in fact these were given free. So somebody is mooching on the system, stealing free money that the American taxpayers has paid for and making a profit out of it. And in so doing, depriving the innocent patients who are very poor to afford these drugs from accessing these drugs. Now, in listening to Victor Nyasulu's account of his perspective on where he thinks the problem is. Now, remember, this guy has been fired from his job on grounds that he acted outside of the regulation during the time when there was a cholera outbreak. In his defense, he feels that there was an emergency, people were dying, and there was a drug shortage of medications and supplies. And so he used a sort of an unorthodox way of purchasing these drugs without the approval of the setup system. And for that reason, apparently he was fired. That's his account. I don't know what the truth is. But the reason he's come out this way is that in the rebuttal, the Minister of Health mentioned names, specific names, in justifying that the Zambian government had been working very hard to try and curb this problem. He listed a number of high officials, top-ranking officials who've been fired to try and sort this problem out in the context of the concern about the American ambassador. And this has riled Victor Nyasulu to the extent that he's an accountant, to the extent that he's come out trying to explain his side and so on. So as I listened to him explaining that, SAMHSA was mandated to buy the pharmaceuticals from abroad and then to distribute them to the various centers around the country. And that is their only mandate: purchase, procure, and distribute. So in the supply chain of drugs in Zambia, you've got the theft can happen at the level of SAMHSA level, where the drugs are bought and then stored and then distributed. Anywhere within that supply chain, theft can happen. But the theft may go beyond that. It may happen at the level of the hospitals and clinics where those drugs arrive at through pilferage, or there could be syndicates that steal the money directly from the facilities, health facilities. That's the final stage before it gets to the patient. So there are all these different places where theft could be happening. And by the way, this is a perennial issue. This is an issue that has been affecting Zambia for years. Several governments have talked about this same problem. The UPND government, when it came into power in 2021, one of the issues was the theft that was going on and the inefficiencies in the healthcare delivery. They talked about drug availability was at 35%, and so they worked hard and got it to 54%, and then currently they say it's at 75% drug availability according to their records, meaning that 75% of drugs needed in hospitals, and I think they're talking more of essential drugs, and they've got their own definition, that 75% of essential drugs are actually found in most Zambian institutions of healthcare. But word on the ground is that there's a disparity between what officially these numbers come out and what is actually on the ground. And one parliamentary committee that was led by Christopher Kalila, who was actually my junior at med school, and he was about a year behind me. He came out and argued with the official government, official government statistics that actually the availability is much lower. It's just below 50%. Why have I taken time to kind of go into all this thing and try to explain the potential solution that I'm trying to propose to the Zambian government? I've been working in Canada for the past 24 years, and I have seen firsthand just how efficient the system here in Canada when it comes to drug distribution is, and so on. You hardly hear of any such problems as pilferage and so on, and delays in delivery of much needed drugs to the patient, because the Canadian system realizes that it's crucial to get this right if you're going to have a universal health care. Canada has universal health care, meaning every Canadian doesn't have to be wealthy to access the healthcare system. Now, one of the reasons that the Canadian system is working is self-regulation. Self-regulation of the pharmaceutical distribution system, or the players that are involved in pharmaceutical distribution. I've noticed, even when it comes to pharmaceutical companies, private companies, there's a time when I came here in Canada in 2001, and the pharmacies were competing with each other, trying to get to the doctor's office and offering the doctor all kinds of incentives so that their medication can be used. They would take us out on trips, fully paid for trips with our families in the most expensive hotels and to attend conferences, etc. This went on for a few years, maybe two years or so. But then the Canadian government realized that this cannot continue happening. We gotta act. So they acted by demanding self-regulation by all pharmacies in pharmaceutical companies in Canada, that if they don't self-regulate, then the government would step in. And that was the end of all those things that I was talking about. So sometimes government policy and action can go a long way in sorting this problem out. So in continuing with this issue of self-regulation, and in this case I'm talking of pharmaceutical distribution, the Canadian system has a very important body that regulates or monitors very, very strictly the distribution of drugs from manufacturer to the patient. And it's called the Canadian Association for Pharmacy Distribution Management, CAPDM. All right. So what's this animal? What's this association all about? So perhaps I'll, from time to time, show you. I'm using my iPad here, and I can, from time to time, try to zoom in to show you what I'm talking about. So I'll just read a little overview on the Canadian pharmaceutical distribution. So in Canada, pharmaceutical distribution is vital, highly regulated process managed by pharmaceutical wholesalers, self-distributing pharmacy chains, responsible for delivering over 95% of all pharmaceuticals to various healthcare settings. This system, recognized globally as a gold standard, ensures efficient and safe access to medications for all Canadians. Now, what are the key aspects of pharmaceutical distribution in Canada? One, centralized distribution. So that's similar to SAMHSA, all right? Pharmaceutical distributors act as intermediaries, simplifying the complex and highly regulated system between manufacturers and dispensing points, which are pharmacies and hospitals. So instead of having only one national distributor, as in SAMHSA, Canada has several distributors that act as intermediaries between manufacturer and target institutions. The second point that's brought is efficiency and accuracy. So how does this system ensure that the right medication is delivered to the right place? So distributors deliver medications with high precision and safety, ensuring the right drugs reach the right place at the right time. Okay, right drug, right place, right time. All three are crucial in the delivery of good health care. You can't have the right drug but delayed delivery, patient dies. You can't have the right drug but going to the wrong place because the order wasn't followed properly, and so on. The third point is essential service. So they handle over 4 million deliveries annually with greater than 99.9%. Yes, you heard it. 99.9% accuracy. Quickly addressing product recalls and drug shortages. So even drugs that are expired, the system detects that very efficiently, almost 100%. And also where there's drug shortages, the system will be able to help. The other component of a good distribution system is to have regulatory compliance. What is meant by that? Regulatory compliance means distributors operate within and comply with Canada's highly regulated healthcare system, ensuring the safety and efficacy of the drugs they handle. Now, before I bore you, probably you'll be saying, hey, it's boring because you're reading and all that. We want to... Okay, we just hang in there. We'll get to what I'm trying to suggest. So, here comes the role of CAPDM, the Canadian Association for Pharmacy Distribution Management. This entity plays a crucial role in representing the interests of pharmaceutical distributors and advocating for best practices in the industry. That's where the self-regulation I was talking about comes in. So what does this do when you have an organization like this one? It impacts on drug access. Okay, so efficient distribution ensures prompt access to medications, improving patient outcomes. Impact on drug access. Efficient distribution helps ensure that patients have access to the medications they need when they need them, regardless of where they live, what type of pharmacy they use, whether it's a private pharmacy or in a hospital. This access to medication is critical for management of chronic conditions. We talked about ARV, anti-TB drugs, as in case of Zambia, and so on and so forth, anti-malarials, treating acute illnesses, and supporting overall health. Drug shortages can have significant negative consequences for patients, as we all know. So efficient distribution helps mitigate these risks. So in summary, Canada's pharmaceutical distribution system is a vital part of the healthcare landscape, ensuring that the medications are safely and efficiently delivered to the patients across the country. So I'm going to show you a picture. So I'm right now, I don't know if you can, let me see what I can do to try and so that you can follow what I'm doing. So I'm on their website. You guys can go there on your own and read this website. First of all, let's see who are they? Maybe we need to find out who they are. Then that way we can see whether we can create something similar in Zambia. So the CAPDM represents an industry that provides an indispensable services to Canadians, supplying, let me zoom this, supplying pharmacies and hospitals with essential drugs. And that's their name. So it says here that we are advocates, not just for pharmaceutical distributors, but also for drug manufacturers and the pharmacies themselves. It can be a delicate balancing act because something beneficial to a member in one sector can be detrimental to one in another. So we always strive to find solutions that work for all members. On an ongoing basis, we liaise with the provincial and federal governments and help form regulations. We host think tanks. All right, think tanks are very important, with business leaders to find innovations that keep not just goods, but the industry itself moving in the right direction. As well, we set standards and monitor developments both here and around the world. That's very crucial. We are the voice of an industry that more than ever needs to be heard. And they say we continue to provide education forums in an industry that is as complex as it's vital. We play an essential role as a unifying force by providing stability for diverse membership with common interests. We are they go to people when there's a supply crisis here. When there's a supply crisis, prepared to do whatever is necessary to help Canadians in need. Very interesting, isn't it? So now I wanted to share this. Let's just zoom on this. This is the diagram that they have to show how pharmaceutical distributors would benefit from CAPDM. So first of all, governments. So they deal with governments, they deal with manufacturers, they deal with the patients, they deal with the pharmacists. Okay? On the government side, when it comes to Canada's pharmacy supply chain, CPDM is the one authoritative and trusted voice to governments and stakeholders. So as advocates for pharmacy supply chain, the impact of CPDM's work extends beyond pharmaceutical distribution as we constantly evaluate the needs of stakeholders and the broad membership, which includes manufacturers, pharmacies, essential third-party service providers, etc. In this role, CAPDM is a unifying force for an industry that is as complex and is vital. It was founded in 1964 and is driven and is mandated to drive healthcare forward by having its finger on the pulse of pharmaceutical distribution, by reaching out to key stakeholders and continually initiating discussions with governments in every jurisdiction and regulatory agencies associated with pharmacy supply chain. CAPDM is able to monitor important developments, etc., etc. So, so let's just go back. Okay, where were we? Okay, we'll go back to, what am I doing now? Okay, yeah. So I showed you how they deal with the government. How about with the patients? Patients can count on receiving the right medicines at the right time with confidence in the integrity of the medicines. So Canadians will generate over 700 million drugs prescriptions to manage their health in 2020. Thanks to the behind-the-scene work of Canada's pharmaceutical distributors members, this prescription will reach each patient securely and quickly. Every patient, every Canadian pharmacy hospital has access to the drugs they need. So I think without boring you guys, let's get back to the discussion. Yeah, without boring you further, let's get to the discussion. So I've shown you that back in 1964, Canadians were facing the same problem that Zambia is facing. The issue of distributing these drugs. And they've come up with this association. It's not even a government agency. It's the pharmaceuticals, the players in the supply chain of pharmaceuticals, that's the manufacturer, the distributors, and so on, that have come together to self-regulate and set up gold standards, okay, on how to do it efficiently. And they're using technology. IT is very important. In this today's age, you cannot be doing paper records of your drugs because that's what leads to theft. You have to computerize your whole distribution system. So they're using IT and other innovative ways, but they also require these pharmacists to be members of this association so that they can be held accountable to the association. The association liaises with government, tells government what the problems are, and how they can help resolve the issue. So this is an approach that is not just an issue of catching the thieves and putting them in jail, because corruption is so endemic in the country that for you to manage to do that with a very weak police force that cannot be everywhere, and the investigative agencies are limited in how far they can go, the best is to self-regulate. So if I were a parliamentarian, I would come up with a suggestion to implement a similar supply chain pharmaceutical distribution system as Canada has. You can tweak it to your own needs, but something similar where every pharmacy, every distributor, every manufacturer based in Zambia is accountable to their colleagues, and to ensure, partly to ensure that they are complying with the gold standards on how to go about this. So, finally, this is the message I wanted to share with you, that there's a solution to these problems. You can't keep firing director generals upon director generals, and some of these firings are just, to hoodwink the population that you're doing something about it when you're actually not doing anything about it. We need to combine both law enforcement to punitive measures like not draconian, but stiffer penalties for those found. Apparently one guy was found distributing stolen drugs in a pharmacy and was only fined 20,000 kwacha, which is peanuts, and let go. So you need to have punitive measures in order to curb this vice of pilferage. And you need regulatory bodies that have some kind of teeth. There must be some kind of penalty attached to this membership. In Canada, there are certain associations that become mandatory to belong to if you're going to even practice anything. Like, for example, I'm a member of the CMPA, which is for the insurance, that if anyone accuses me of having mistreated my patient, I have legal defense towards, it's called Canadian Medical Protection Association. It's an entity that every doctor must have. If they don't have that, they cannot practice medicine in Canada. So you can make it mandatory for all pharmacists and pharmaceuticals to be part of this association. Now, I don't know if Zambia has something like that or not. Maybe you do, but in case you don't, here's a suggestion. And in case you do, maybe go on that website, read about it, and see what lessons can you learn from the experts. Canada is an expert when it comes to universal healthcare. You don't have to reinvent the wheel, I often say. Learn from systems that are working elsewhere. Cut and paste or copy some of those gold standards, best practices. Implement them in your own unique way that works for your country. I hope my suggestion, ladies and gentlemen, will be useful to you. Share this video with officials in the government in Zambia, and let's talk about it. Let's discuss it. I'll be coming to Zambia sometime, and if people want to chat and hear directly from me, I'll be happy to offer that. But I've got very limited time because it's a private visit, so maybe we can meet up and talk about it more. But feel free to discuss this issue here. And if you say, Doc, you spent a lot of time telling us this in Zambia, that's not the problem. The problem is here. This is where we should be focusing. Yeah, feel free to share that with me as well. with those words, guys, thank you very much for paying attention and listening. I don't think I can see if there's anybody watching here. Maybe a majority of people in Zambia are sleeping. But you can share this tomorrow when you wake up, watch it, and then talk about it. Take care, guys. God bless you. God bless Zambia.